Greetings from Human Biological Institute. Welcome to another engaging session of our scientific forum, Immunize Talks. At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through our one-of-its-kind platform, Immunize with Pride. Immunize with Pride is an awareness initiative dedicated to educating the public about preventable diseases and the importance of timely vaccination. These sessions feature leading experts from across the country who share their valuable insights on key health topics, aim to raise awareness and promote overall well-being of the society at large. Today, we are delighted to have Dr. Sudheer Kumar with us to share their perspective on protecting high-risk populations, the importance of hepatitis A vaccination. I shall be sharing more about today's speaker in a short while. For a moment, please allow me to share a brief introduction of Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited. IL was established in 1982 by National Dairy Development Board, NDDB, as one of its units and later incorporated as a company in 1999. HBI was founded in 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. Our first manufacturing facility was set up in Ooty. This facility is one of its kind in India and rolled out the country's first Virocell rabies vaccine in the year 2000. Today, we are a leader in the ARV segment with a presence in and around 60 countries. HBI has launched several other vaccines and become a major player in human vaccine segment. HBI is a key player for pentavalent vaccine to the Government of India under its Universal Immunization Program. In yet another milestone, HBI introduced Havishor in 2024, India's first indigenous hepatitis A vaccine, aimed at providing protection for both children and adults. With a vision of shaping global healthcare by spearheading the One Health initiative and the mission to innovate, produce, and market quality healthcare products and services to improve and extend lives, we are committed to providing affordable, high quality products through continuous technical innovations to meet our customer needs. As a market leader, we have taken a significant step towards reducing plastic burden by 160 tons per annum through the introduction of eco-friendly packaging for our flagship brand Abhirab. As a part of corporate social responsibility initiatives, we have adopted schools where IL provides infrastructure support and basic facilities, including assistance with the midday meal program. In association with NDDB through the gift milk program, hundreds of school-going children benefit from daily milk nutrition. We have also donated an oxygen generation plant to Telangana Institute of Medical Science and Research Center during the COVID times. These are just few highlights about Indian Immunologicals Limited. For more information, please visit our website at www.indieimmune.com. Immunize with Pride is one of our unique initiatives which emphasizes the vaccination not only protects the individual but also strengthens community immunity. Welcome to today's episode of Immunize Talks. This session is dedicated to a highly significant topic, protecting high-risk population, the importance of hepatitis A vaccine. Today, it's a privilege to introduce Dr. Sudheer Kumar, a highly respected pediatrician and pediatric nephrologist and a leader in advanced child healthcare. Dr. Sudheer Kumar is currently a director and a consultant pediatrician and pediatric nephrologist at Blossoms Hospital, serving patients in Guntur and Vijayawada. He completed his MBBS from Guntur Medical College, MD in Pediatrics from Andhra Medical College, Visakhapatnam, followed by a fellowship in pediatric nephrology from Christian Medical College, Vellore. He has also received international exposure to an ERA EDTA clinical fellowship in pediatric nephrology at Heidelberg University Hospital, Germany. Dr. Sudheer Kumar is an active member of several prestigious national and international bodies, including ISPN, IAP, IPNA, ERA, EDTA, and the International Society of Nephrology, and has been extensively involved in research, publications, and academic activities. We are honored to have Dr. Sudheer Kumar with us today to share his expertise and insights. Hello, sir. Thank you for joining us today for this very important topic, protecting high-risk populations, the importance of hepatitis A vaccination. So, am I audible?
Yeah, it's audible, ma'am.
Yes. Thank you so much, sir. Thank you for joining us today, taking your time and giving us our viewers a knowledge about regarding vaccinations and hepatitis A vaccinations.
Thank you, ma'am. Good afternoon.
Thank you. So let's begin today's session with some commonly asked questions on this topic. So our first question is, what do you mean by high risk population, sir? And when we talk, and especially when we talk regarding hepatitis A hepatitis A.
Good afternoon to all. Today I'm privileged to talk on immunological talks on Immunize with Pride, one of the high-risk populations of hepatitis A vaccine. As we all know, that is happening. So hepatitis A infection, as we all know, most often occurs through fecal-oral route and due to the close contact population. So coming to that, patients who had a high risk population and was having who risk of infection are international travelers. So as you know, if international travelers move from one place to another place in a high endemic area like India predominantly, they are prone to get hepatitis A infection, which is done by fecal-oral route contact. So overcrowding of the population, international traveling, people living in a poor, impoverished environment, they are the main risk factors that are causing risk factors for the infection. Coming to the high risk, severity of the infection happens in children with already having underlying renal disease or in
Yes, sir. Yes, sir. You're
yes, ma'am.
audible, sir. Yes, sir. Yes, international travelers and all, like they're very high risk, sir.
Yes.
So,
Next question.
as you mentioned, travelers are the one of the populations for this. So, like how children and adult get risk, like the travelers do come. Like India is a very highly populated country. So, how our own population is getting affected with that, and why hepatitis A is becoming more prevalent in India, sir?
Hepatitis is mainly contact by means of fecal-oral route, ma'am, by means of by the motions and also by means of the contact of the who is having the
Yes.
infection that spreads by
Yes.
it, and also the
Yes.
food handlers. That's more important. If food is
Yes.
not hygiene, what we're eating at home, we are eating
Yes.
a lot of food is outside,
Yes,
and
sir.
also
Very
one of
much.
the causes we are getting a lot of infection like foodborne infection like hepatitis A is there, typhoid is there. These are
Yes.
the predominant infections now. Earlier we used to treat like pneumonia conditions, viral pneumonias, everything. But more important
Yes.
can be given to the food conditions like that of the hepatitis A, which is predominant by foodborne infection and also
Yes.
typhoid.
Yes. So very
So
well said,
overcrowding
sir.
also causes these kind of infections.
Yes, sir. As you mentioned, the fecal-oral route is a main route. So, how do like the what are the prevention we can take from this fecal-oral transmission? So, like the when that the population doesn't get affected with hepatitis A.
Most important technique hand wash only, ma'am. Just what we apply, just soap is available or dishwash is available, that disinfectants that we can use in the hand wash. So like 5 touches, like what we use in the hospital, can be predominantly practiced in the public, general public also.
Yes.
So before touching anything, so before eating, after coming from the washrooms,
Yes.
just you have to wash their hands. This is one of the
Yes.
predominant cause of getting infections. These are
Yes.
all communicable diseases.
Yes. Yes, as like sir, you have said the main thing, hand wash is the first thing we have to do. But how can we prevent this in the children, sir? Because the children, the school going children, they always touch something, they eat something, and it's very hard to control the pediatric group. So, what you want to say to the parents who are watching this show, sir?
Parents are taught about the hand washing first, then
Ye-
those they can taught in the school, because already COVID has helped us a lot.
Yes.
So everybody now know the importance of the hand wash, and also the hygienic food, that is more important. So home food concept is more important. So as you see, most of the children are eating in the weekends and also in the restaurant. This
Yes.
is also one of the cause of getting hepatitis, also the typhoid, which are foodborne infections.
Yes.
So better go for the somewhat semi-hot food, like which is available at
Yes.
a cooking availability, so that it can be helpful.
Yeah.
And also one more thing is the clean hygiene water, potable drinking water, which is of TDS about 200 to 300. That is more important rather than using pure RO water, which is devoid of any minerals.
Yes.
So potable water is what is available, that can be heated at home and can be used at 50 to 60 degrees and can be cooled and can be used. These are two important conditions. Using good hygienic food and potable water, which is replenished with all minerals. They're more important in preventing the infection at home by the parents. And when they go outside, also in the schools, also the children can be taught about the hand washing techniques, how to hand wash, how to touch the other people. The more important
Yes.
commensals, to prevent the commensals.
Yes, sir. Very well said, sir. Thank you for this, sir. Sir, as you mentioned, these are the lifestyle changes which can avoid the disease of hepatitis. Sir, I just wanted to know if the child or an adult gets a hepatitis A, it's how serious and complicated it can be.
So children are different from the adults, ma'am.
Yes.
In these children, less than 6 years, usually mostly 70% of children are asymptomatic. They don't present with any infection. So as we all know that hepatitis A infection is a incubation period is very high. Incubation period is about 45 to 180 days. So before a virus enters into the body and causes infection, it may take about 2 to 6 months. So after 6 months only, we usually see the symptoms in case of a children.
Okay.
So because 70% of children are asymptomatic. But when compared to the adults, they are mostly symptomatic. In case of adults, more than six children is more than 6 years. That is, adolescents, big children, and adults more than 40 to 50 years are at more risk of getting A infection when compared to the children. So children presenting symptoms are also different when compared to the adults. Because as say, hepatitis is one of the causes of jaundice in children and adults. But jaundice predominantly as a symptom is not seen in children.
Okay.
Only it is seen most commonly in case of adults. By the time jaundice happens, child usually presents with loss of weight, loss of appetite, and weakness will be there. Some myalgias will be there. Low-grade fevers will be happening. Based on it, if you do the present diagnosis by hepatitis A IgM antibodies and the diagnosis test, and doing the liver enzymes test, we can find out child is having any hepatitis or not. But
Okay.
adults, as they present with symptoms, in case of 50 to 60% of the case, predominant being the jaundice presenting patient, later followed by fever, vomiting, loose motions, myalgias are there. Sometimes itching is one of the complaint. As called genetic Geratis syndrome, one syndrome is there. In this condition, the bilirubin that is gets elevated, gets deposited in the skin, that causes itching also. Intense
Yes.
itching will be there for case of children with hepatitis and also mostly in predominantly adults.
Yes.
So these are the presenting features which are present in adults when compared to children. So children should be followed up gradually. Why they are having these kind of mild symptoms are there, because immune system, immune tolerance, everything is happening. But adults, predominantly symptoms are there. We can diagnose them easily. So based on it, we can do the proper investigations and treat them. Being a viral infection, mostly treatment is only symptomatic only.
Okay. So as you say, it becomes very serious if it is not treated and if the child doesn't get vaccinated. So, sir, like many parents have this mind that hepatitis A is not serious, that they doesn't need a vaccination. So, what is your note on them that how important is a hepatitis A vaccination in India also?
India being a mostly endemicity of the hepatitis A is very high and also increasing a lot. Nowadays, we are seeing a lot of. Recently, 2 days back, I also seen one child, 8-year-old child, present with symptoms of lassitude, weakness, decreased activity. And 2 days, I just written the symptomatic treatment only. Parents went home and found out jaundice. Yellowish discoloration of IC is there for the baby, and they came back. And with
Okay.
the diagnosis, found to be hepatitis A positive, titers are about more than 4. So this is the scenario in case of India, because 1 month back she went to some function, had some food. That is the reason, because in foodborne infection, as we discussed it. So predominant history
Yes.
is more important, and follow up of the symptoms is important. So to prevent these infections, as vaccine is available, these are mostly vaccine preventable diseases, because as you see the foodborne infections like hepatitis or typhoid, so they can be prevented by using proper vaccination. Nowadays, proper vaccination is available. 2 dose vaccination is available with 6 months apart. That can be given to the children as early as possible. As based on immunization plan is also UAP immunization or IAP immunization technique also. At the age of 12 months, we are giving first vaccine, followed by 6 months later, second dose is given. If
Yes.
needed, other doses can be given, but 3 doses are most important for this child. If I catch the child as early as possible at the age of 1 year and 18 months, 2 dose hepatitis vaccine gives protection about 90%.
Yes, sir. Like as you mentioned, the doses of the hepatitis A, like you mentioned 2 doses, sir. So why 2 doses is important for the child for the hepatitis A vaccinations?
Because these was the killed vaccines only, not like live vaccine. So these gives some protection of immunotolerance is available for 60 to 70% single dose. If you give the 2 doses, baby will get about 90 to 95% of the protection. Even 5% we don't know, because we are able to do more amount of children, because but we can able to cover 60 to 80% of the community or population of the children. Then you can develop the herd immunity also. If herd
Yes.
immunity is developed, the risk of transmission of infection is very less, and most of the children who are not get vaccinated, because the remaining 20% also gets protected. So this is the importance of giving 2 dose vaccination against hepatitis A being the killed vaccine.
Thank you so much, sir, for mentioning the long-term immunity for giving 2 dose
Yes.
vaccines and the importance of herd immunity because India is still a developing country, and the people who can afford, they'll afford. If we don't afford, they don't afford. It's an important that some population gets immunity and we give other also immunity. Thank you for mentioning about herd immunity, sir. So some parents have this always in a mind that is it safe to vaccinate children who fall sick frequently or have lower immunity?
It's safe to give vaccine, right? It's most of because vaccines are two types, as we all know. They are killed vaccines and live vaccines. If child is having any severe infection, immunodepression is there, live vaccines are usually contraindicated. Like what I see in the pediatric nephrologist, we use a lot of nephrotic children, which are immunosuppressed children. In these children, we will tell them not to give any live vaccine. But being a killed vaccine, these vaccines can be safely given any children who is sick also.
Okay, sir. Thank you, sir. My next question is why is hepatitis A vaccination important for school going children, hostelers, and daycare settings? We have some technical issues from the doctor end. Doctor will be joining in 2 minutes.
పోస్ట్
Hello.
వచ్చేసింది.
Sir, am I audible, sir?
యా ఆడిబుల్ మ్యామ్, సారీ.
Yes, sir. Yeah, no worries, sir. Thank you for joining us again, sir. Our next question is why is hepatitis A vaccination important for school-going children, hostelers, and daycare settings?
So these children are more from getting overcrowding and also the close contact with the persons who are having hepatitis A virus infection. So to prevent this hepatitis A virus infection spread among this as already discussed. So more common
Yes,
in case of close contact and overcrowding. So this is
yes,
more important vaccination should be given in case of children with all school going children in hostelers and also day schoolers.
yes. Thank you, sir. Thank you for answering that. Sir, as you mentioned, this vaccine is safe, inactivated kill vaccine. What are the other side effects that should parents be aware of any vaccination or hepatitis A vaccination, sir?
So
So,
first question,
after the vaccine,
any parent who comes to vaccination first will ask is, does it cause fever? So main culprit for them is the fever. So what we
yes,
tell, we educate them about the fever only. So tell them that some vaccines are no painless vaccines are available. So for say little pain will be there, and main side effects we need to consider about the high grade fever is there, and mild soreness or tenderness at the site of infection is normal. And low grade fever may happen with the killed vaccine, and also the risk is less when compared to that of live vaccine. Killed vaccine risk is very less of fever. And other risk
yes,
factors like idiosyncratic reactions or hypersensitivity phenomenon, which rarely occurs in 1 in 10,000 like that. If the hypersensitivity phenomenon should be observed in any children who present with some knives like that, and also some hypotension, everything, risk factors will be there. So you need
okay.
to educate the parents before giving the vaccination, explain to them these are the safe vaccines, risk is very less.
Okay, sir. So it can be treated with a simple paracetamol. If
Yeah.
any fever are there, it can be treated. Okay. So thank you, sir. Sir, my next question is if a child misses a scheduled hepatitis A vaccine, can it be given later?
Yeah, if child has given one vaccine has given it at the age of 1 year. Child misses the vaccine, second dose can be given later also. So there is
Okay.
no need to give again the vaccine. Two doses of vaccine is not needed. You can give second
Okay.
dose, get a dose is completed.
Yes, sir. Sir, as you're a pediatric nephrologist, I have also question for the adult nephrology cases. Like as nowadays everyone is diabetic and they are getting into CKD or they are getting into dialysis and all. So if how important is vaccination for adults also who is immunocompromised, sir?
These are very important now. Adults also we are doing some companies are also promoting this, like pneumonia vaccine. What we see common cause of pneumonia, one of the common cause after COVID for
Yes,
immunosuppressive condition. Also adults also when you're diabetic being immunosuppressed.
yes,
So better to give these vaccines. Hepatitis A vaccine, hepatitis B vaccine, which is not done previously, should be given to all the adults also, along with pneumonia vaccine and influenza vaccine.
yes. So, as I will, we usually nowadays everyone is getting their own investigations. Like they get their own sugars, they get kidney function test or something. So, is any indication that if my kidney function test is not proper or my sugars are high, is there any cause for the any hepatitis disease?
Hepatitis is won't cause by use of renal conditions, ma'am, per se. But
Okay,
hepatitis infection is there. It may result in multi-organ dysfunction. So we
okay,
have seen hepatorenal syndromes also in case of commonly in children. So we have
yes,
diagnosed a few cases who present with hepatic failure also, like acute
okay,
pulmonary hepatic failure, going into
yes,
encephalopathy also with hepatitis A infection. Rarely you see.
yes,
But for
yes,
the children, some of the cases we have done being plasmapheresis also done to recover.
yes.
And children
Okay.
luckily recovered with the plasmapheresis.
Okay. So thank you, sir, for all the questions. I just want to ask you a last question. That please give me three takeaway points to our viewers from this interview, sir.
So most important, as we discussed, is the mostly fecal-oral route and contamination by foodborne infection. So have good hand wash, proper hygiene, and proper food techniques, and get prevented by having proper hepatitis C vaccines. 2 doses which should be given to all the children in our community. So we as parents also need to be educated about the hepatitis A vaccine, and we are pediatricians. We usually all the pediatricians. So for the common public, it's better to get whatever vaccines that are available, better to be taken by all the kids. And also adults in case of high risk categories like diabetics, immunosuppressed, like patients with anti-cancer drug should get vaccinated properly because they're all killed vaccines and the safe vaccines. So please prevent the infections and live happily.
Thank you.
Thank you.
Thank you, sir. Thank you for being a part of this Immunize talks. We hope today's session was informative and valuable in spreading awareness on protecting high risk populations, the importance of hepatitis A vaccination. A special thanks to Sir Dr. M. Sudheer Kumar for sharing his time, expertise, and insights with us today. For those who would like to revisit the program, the video will be available on our social media platforms. Please follow us on Twitter, LinkedIn, Facebook, and subscribe to our YouTube channel.
Thank
Thank
you
you,
for
sir.
giving the opportunity, Human Biological Institute.
Thank you,
Thank you.
sir. Thank you, sir. Do like, share, spread the word to as many as your friends, family, and relatives. Until we meet next live talk, stay healthy, stay aware. Please take good care of yourself. Thank you so much, Sudhi sir. Thank you for joining us
Thank you.
today.